So I'm seeing the axial view of a patient. You can see there's a cleft alveolus here. That's the defect on the upper jaw. And then you can see how the septum is deviated right from the base. So we're planning to do multiple procedures for this patient, which includes anterior maxillary distraction, rhinoplasty, nose job, bone grafting to a certain extent at least to get this defect filled. He also has speech issues, we're doing speech surgeries. I'm going to show his 3D view. So he's had multiple surgeries before. He's had 4 surgeries done before, but you can see he has a lot of issues with his upper jaw. There's less growth, so we're going to address that with distraction. He has some root stumps, we're going to take care of that. This is the cleft alveolus, it's still large and wide, which I also showed you the other view. Now I'm going to go to the coronal view and look more at what we need to do in the nose. So you check that deviation there. That's like a huge deviation. So I'm going to have to do a septoplasty, septal harvest, and also fix the bony issues with the septum. Nasal bone is also deviated, so obviously need osteotomies to move the nose to the midline. It's very essential that when patients need these kind of face makeovers or multiple procedures on the face, that a thorough examination of their CDs be done. This is the orthopantomograph. So there's a root stump here. This is not of much consequence for us, but this is. So we're gonna probably take it off much before we do the anterior maxillary distraction. And I'm gonna move on to the next view now. We'll try and see the longitudinal view now. So we have the longitudinal view. Once again, you can see the deviation of the septum, the alveolar defect. I think I can show you the measurement of this. And this is a pretty large defect. See that? That's 16 millimeters now. Sorry. Okay, then I'm going to take another tool and measure the width here. At 7.66 and 16.9 is the length at the lower part of the alveolus, and that's at the upper part of the alveolus. We can also see the length in between. So this is kind of a measurement that gives me an idea about the amount of bone that will be needed. And you see that, that's about 7.5. So it's not a very small defect that he's having there. Anyways, so that's the terminal aspect. And I'm going to go back and have a final look at his 3D. So there's his 3D. So obviously you cannot make out so many issues that we saw on the other views as in the 3D. But you just get an overall view. Thank you.